Okay, this is the question most people despise on the Aemca. There's going to be several of them. Your college should definitely have several of them to get you prepared. And it's what is commonly referred to as a multiple. These take a lot of time, and there is a very specific way to do them to ensure success. You definitely don't want to start this looking for the answer. You want to start this looking for a clear wrong answer or detractor. So, you notice the patient's breathing is no longer labored. Okay. Respiratory assessment reveals patient respirations are 10, regular and full, with no evidence of increased respiratory effort. That sounds good. Patient SATs are 100%. You opt to remove the nasal cannula you had previously applied. Patient SATs remain 98% despite the removal of the oxygen. So he's doing way better. Patient has no complaints. Auscultation reveals clear air entry, apices to basis, bilaterally. You suspect the following are reasons patient's breathing and oxygen saturation was abnormal on arrival. Okay, so what is this doing? This is giving you a pile of information to state, hey, look, this person, their respiratory system is working absolutely perfect now. But when we arrived, he had SATs of 88, he had labored breathing, irregular breathing, he had snoring. So this is to ensure that you understand the pathophysiology behind why his SATs were failing in the beginning and why they aren't now. And why is that happening? Well, it's because his airway was obstructed. So what this is really asking you is, why would O2 SATs drop with an obstructed airway? Complicated way to ask you it, but that's the Aemca. Questions and questions, and logic problems in almost every question. So why would you have low SATs from an obstructed airway? Would it be carbon monoxide poisoning? You want to see something like this because this should be a clear no. That's crazy. Well, it's not crazy, but there's nothing at all whatsoever about the scenario that supports that. And carbon monoxide poisoning would not have a low SAT. So that's awesome. You want to find that right off the bat. That's not the answer. So then before you even use any more brain power, you want to go down to your multiple choice and eliminate anything with one. But unfortunately, I made this exam, so that only buys you one question. Oh, well, it's better than nothing. Now there's only 3 answers left. Let's keep going. Traumatic brain injury, increasing ICP, and applying pressure to the pons. Well, traumatic brain injury definitely should have been something entertained earlier on in the scenario, and it definitely can cause seizures. So you could have that. But if you had a traumatic brain injury and it was applying pressure to the pons, and that was the reason that this guy had a seizure in the first place, once again, back to the logic of the hypoglycemia, you're telling me that just fixed itself? No, that's not how that works. That just gets worse and worse and worse until you die, or hopefully you make it to a hospital. So that doesn't make any sense. So we'll get rid of that. Patient had a VQ mismatch problem with ventilation on arrival. Okay, so that's ventilation versus perfusion. And what's the problem with this guy? Is it ventilation or perfusion? Well, an airway obstruction causes not enough ventilation to the alveoli, so it's ventilation. So that one is correct. I'm getting my head ahead of myself a bit. So we had eliminated 2, so let's go down and eliminate anything with 2. Sweet, that buys us one more question. So now we're down to C and D. And I just said 3 is in it. And if you're really, really confident on 3, that would already tell you that D is the answer. But let's not do that. Let's keep going because you wouldn't want to jump to any conclusions. Patient had a lack of oxygen arriving in the lungs. Yeah, that makes sense. And it kind of follows the problem with ventilation. Patient had a VQ mismatch with circulation. Well, we know his circulation mostly, and he had a good blood pressure and a really good heart rate, so there's no reason that he should have that. Let's eliminate 5. That's already your answer, but let's just finish this. Patient had a lack of ability to expel carbon dioxide on arrival. Patient had a lack of ability to expel carbon dioxide on arrival. Well, it makes sense that if he can't get enough oxygen in, he probably can't get enough carbon dioxide out. Would that contribute to his overall poor respiratory status? It would. The primary drive to breathe is carbon dioxide. Yeah, let's keep that. seizure causing irregular and sometimes absent respirations prior to arrival. Now we do know enough about this guy to suppose that to the best of our knowledge, the reason he was unconscious when we arrived was he was postictal from a seizure. And if he was postictal from a seizure, then it stands to reason that during that seizure, he was not breathing appropriately. And that would have absolutely contributed to the low sats with all these other factors that we noticed when we first arrived. 7 is a little bit complicated to put together, but it's definitely there. 8, a drop in blood pressure caused inadequate circulation and hypoxia. Nothing to support that, right? The heart rate's fine now. There's no clear... That would kind of go with syncope, but there's nothing to support that, so you can get rid of 8. That leaves 3, 4, 6, 7. 3, 4, 6, 7. They're not easy. Find something that's clearly a terrible answer and use it to eliminate as many options as possible. Even if you are totally in left field and you really don't even understand what's going on here, you should be able to give yourself at least 50-50 odds. Of course, you want to understand your pathway, you want to know everything, but by following this method, even if you're lost, you can greatly increase your chances of actually getting a correct answer.